Hello, this is Dr. David Cavazos, chiropractic physician, licensed in the state of Illinois, practicing for 25 years. Today we will be discussing degenerative disc disease, which is one of the reasons of low back pain and sciatic. First, we're going to review the anatomy of the spine. The anatomy of the spine, to start, this is the vertebrae, and in between the vertebrae we have the discs. The disc is composed of the annulus fibrosus and the nucleus pulposus. Typically, this is the area of disc pain, disc insult, and the whole mechanism, which we will discuss, of low back pain and sciatica. Inside the neural canal, that's all structured by bone, is the spinal cord. Off the spinal cord, we have spinal nerves. And in cases of low back pain, as you can see here, once trauma is introduced to the spine, we have biophysiological changes of dehydration, desiccation, which basically means the disc starts drying out. You get annular tearing of the disc, which leads to a protrusion, or more innocently, a disc bulge, which can also be a sign of pain. This disc protrusion impinges on the spinal nerve, and that makes pain. That makes a pain called radiculopathy. The common word for radiculopathy is sciatic. And basically, this spinous process, spinal column, is in the low back, and it hits the spinal nerve, which sends a pain signal down your leg. That pain signal is sciatica. If it goes to the knee, it's a medium level problem. It starts going into the calf, it's a moderate level problem. If it starts going into the foot and into specific toes, that's a severe sciatica. Now, what severe sciatica does is, first of all, it causes a lot of pain. You get a lot of inflammation, changes into the low back. In severe cases, you start getting weakness of your leg. You can get foot drop. You can get more spurious when it hits the spinal cord, called quad equina syndrome, where you have bladder and bowel problems, which a chiropractic physician looks for these things, diagnose these things, and properly get medical care for these patients. In the progress of disc protrusion, which is seen very well here, where the nucleus pulposus has popped out into the spinal cord and causing a great deal of pain in this situation because of the nerve impingement, which will elicit sciatica. If it goes to the left side, it's going to make a left sciatic. If it goes to the right, it's going to make a right sciatic. If it goes straight back, it could be either or both legs at once having sciatica. So the anatomical position of the protrusion does show us the relationship of the sciatica. And as the disc insult occurs, you end up with osteophytic changes. This is an arthritis in the spine. You start getting osteoporosis. You start getting disc space narrowing. And what this is called degenerative disc disease. Many physicians will say DDD, which stands for degenerative disc disease. And ultimately, in the final process of degenerative disc disease, you start getting, I call it God's solution, because he starts fusing the vertebrae together. The medical term is ankylosis. And this is stage 3 of the DDD. And what happens is you get fusion, the nerve root is still impinged by the disc protrusion. They can still have sciatic, but the big acute pain is usually gone, becomes a more chronic situation, low back pain. It could affect your gait, it could affect how you sit, how you sleep. Chiropractically, what I do, we start with exercises, which is a postural core exercise to the low back. We have Mackenzie's, which is a low back exercise for strengthening the low back. I use traction. I do traction with my hands, manipulation type tractions, also flexion distraction, and what we're doing is we're opening up the disc space. We're taking the disc pressure off the nerve root, which reduces the sciatic. Another effective method that I use is called high volt. Where the sciatic is we place these electrode pads down the sciatic, 4 pads, and we treat for 20 minutes with high volt. And this is very effective for many of my patients for reducing the sciatic, for improving the patient, to help the patient the best we can. We also apply physical therapy consistent of ultrasound to the low back, and what ultrasound is it's anti-inflammatory, it brings more blood, and it helps the patient. Typically, disc problems, sometimes they can get better in weeks. I've seen disc problems get better in days. I've seen disc problems take months to get better. An average for a moderate sciatica, it can be 2-3 months of treatment. We do it conservatively. We do it without surgery. We're very sensitive in treating our patients here, and we do the best possible job for our patient for the road of recovery. If you want to reach me, you can reach me at 630-915-3600, or I am located in Carroll Stream, Illinois at 66 East North Avenue, zip code 60188. Thank you. This concludes low back pain, sciatica, and degenerative disc disease.